And then if anyone has a question, please speak up, and I'll try to answer it as I go, okay? All right, so you can come on in here, Jarrell. Before we clean the hood, we have to garb up. Every time you garb up, you need a new mask and a new hairnet. So those are not reusable. So your first step whenever you garb is going to be, you're going to rinse your arms all the way up to your elbows, and you're actually going to use the fingernail pick. We currently don't have any, we're working on getting some more right now, but the first step is actually to use the fingernail pick. Then after that, you'll apply soap, and you'll clean all the way up to your elbows. And you're supposed to scrub your arms for 30 seconds. All right. After cleaning, try and let the water drip from your elbows, not from your fingertips. And use a low lint wipe to completely dry your hands and your arms. And you'll get a gown. Inside this gown, there's another clean, sterile wipe that you can use to dry your hands. Then you'll put your gown on. After you put your gown on, you're going to sanitize your hands before you put your non-sterile gloves on. And let these dry. Don't wave your hands like this, just let them dry. Then after we get our non-sterile gloves on, we're ready to start cleaning the hood. Now, in terms of using sterile gloves, you can put additional sterile gloves on before you clean the hood. However, we're going to be opening this up anyways, so you don't actually need to put sterile gloves on. So, in terms of the order of how we're going to clean this, so the general rule is cleanest to dirtiest, top to bottom, for everything. Okay, so the cleanest side of our hood here is this side, which is ISO 5 air. So we're going to start with this side, then we'll go to this side, which this is ISO 7 air, so a little bit dirtier. Then after we clean the hood, that's when we'll clean our cart, and then lastly the sink. Okay, so to start, we'll go ahead and we'll open the hood. And if I'm doing something that differs drastically from your process, Karen, please let me know. I watched Rose and I watched Brenda do it, so and I kind of got some of the feedback from them, but I want to just make sure that I'm not missing anything important. Okay? Mm-hmm. So to open this, you pull down the latches here, you lift it up, It's okay to have these hanging down. We will clean these sleeves eventually as well. Now, if you look inside the hood here, there's these wipes. These wipes, because they were only opened in the hood, have a 15-day BUD. Okay, we've been writing the day that they were opened on here. Okay, so it's okay to take them out of the hood as long as this remains sealed. Do not reopen it until you have the hood closed again. It'll retain its 15-day BUD. Okay, if you were to bring it outside of the hood, we just keep the most conservative beyond use date. So if this was a new pack of wipes and it was opened for the first time outside of the hood, then it would be good for 30 days. But because we had already assigned it a 15-day BUD, it'll keep that, since that was what it was assigned when it was initially opened. Okay. All right. So the order of cleaning this hood. So every day, twice a day, we use the Decon Quat to clean this hood. Okay. And so this is done in the morning and the night. And a few things to clear up. We're not supposed to spray directly on the surface. We can spray directly onto a lint-free wipe like this. So to clean this hood, I'm tall, so I can reach all parts of this hood, but well, there's usually do you know where the reacher thing is? Okay. For today's purposes, I'll just clean it, but there is a extendable pad as well to help some of the people that can't reach, and that is usually in here as well. But for today's purposes, I'll show you how to clean it without it. So I have about maybe 15 wipes here, and I have some of them on the ground. I'll pick them up in a little bit. I really get this sucker wet. And then you're gonna clean in a unidirectional pattern, starting with the pattern that I explained. So cleanest to dirtiest, top to bottom. So the first thing you're gonna clean is actually the ceiling of this. And the cleanest part of this hood is the back. The dirtiest part is the front, which is closest to your gloves. So that's why I'm starting in the back and working my way towards the front. And you can also clean this. Okay. After we do the ceiling, we're going to do the back wall. Now, for each surface, you want to get a fresh wipe. So basically what I do, the reason why I kind of soak this is I'll take off one layer and I have a layer underneath already wet for the next surface. There. So that was the back. The next thing I'll do is work on the sides. Once again, cleanest to dirtiest. So cleanest being the back, dirtiest being the front. Okay. Same thing to the other side. Cleanest on the back, dirtiest in the front. Okay. Notice how I'm getting a new wipe each time. All right. Then after this, before I clean the dirtiest part, which is my work surface, I'll clean the bar here. I'll remove these and I'll clean the inside piece. This, one of the things that you do first is you actually replace the trash here. So I'm not going to do it now because Karen, you just replaced it this morning. It's pretty empty. But you would actually take this bag out and clean the ring here as well. And you can reapply cleaner to your wipes if you feel that it's dry. Just try not to spray in the hood. Yes.
So what if it's still dirty?
What is?
Like the countertop or the thing, because there's a lot of splashes going on.
Yeah.
So that really doesn't.
So you're saying that this cleaner doesn't clean it?
Right.
Correct.
Exactly.
So it's a special case. So if you notice that there's like a little spot or something that won't come up, there's a couple of different strategies that we can actually employ to get rid of that spot. Okay. If that happens, please come talk to myself, Megan, or Alicia. But one of the things that we will commonly do is we'll take sterile water for irrigation, and we'll take a pad and we'll put sterile water on it, and let that sterile water sit on there for about a minute, and then we'll clean it up. Most times that will clean the part that won't come up with this cleaner. Okay. If not, there is more extreme measures that we can take, but there's like a stepwise process to it. Okay? Alright, so the next thing I'll do, and for this, we can take out which you can see here for now. These are garbage. And these can temporarily come out as well. All right. So we have a couple more pads here. Last one. Last thing that I'll clean, which is the dirtiest, which is closest to me, is this inside of this and the sleeves. Okay. And sleeves. As you do this, you want to inspect to make sure there's no rips. This is a good opportunity, if there is a rip, to replace the sleeves. All right, so this is the ISO 5 side that I just cleaned, okay? I cleaned it using Decon Quad. You saw the process. This process would then be repeated using sterile alcohol wipes, using these. So you would repeat using those wipes, and then after that, we can go ahead and close it up. I'm not going to clean using the sterile alcohol wipes now. This is for educational purposes. The tech had already cleaned it this morning. Yes?
What about underneath the things?
Excellent point. I forgot to mention that. So yes. So probably the best order to do this is after you clean your workstation on the top here. So before you clean this, I would go ahead and lift this up and also wipe underneath here. I totally forgot about that. Thank you, Karen. This bag would not normally be here. If there's anything that's loose here, take it out. And Karen, do you normally clean on the underside here? You do? Okay. So in that case, yeah, so I would clean on the underside here first and then this part. So. Does that make sense?
I have another question.
Yes.
So if you were using the extension, I think it's up here somewhere. Is it up there somewhere?
Oh,
Right, Tony, is it up there? You
yes,
see it? Okay.
yes, yes.
So we put a pad on here
Yes.
with a cover. So do we change the cover each time also, or?
Yes, so best practice would be to change the pad for each surface.
Okay.
I know that it might
And the
be-
cover, right?
yeah, so the...
There's a pad and then there's
Yeah,
a
so
cover.
change the cover on the pad for each surface that you're cleaning.
Okay.
Does that make sense?
Yeah.
Okay. I know that might be a little bit more than what you're used to, but we'll make sure that there's enough covers
Yeah.
to clean it properly. This is best practice, what I'm talking about here today. Okay? Any other questions about this process so far?
No,
Okay.
just the other, that one, if you were to clean it, like
Yes.
every Monday.
Yes.
So how is that process done?
Yes, great question. Would you like to throw this away from me? Okay. So, every day, twice a day, we use this, followed by sterile alcohol, right? Once a week, we use our Decon Spore. This is a sporicidal agent. Basically, you can think of this kills everything except spores. Okay, so once a week we gotta clean for spores. It's the same exact process with as Decon Quat, except instead of Decon Quat, you're gonna Decon Spore. So you clean this entire hood using the process I just demonstrated, followed by sterile alcohol. Okay. Yes.
So this and then that also,
No.
or just this for the Monday? That
Just
Monday
this for Monday. It's just this, and then afterwards you have to do alcohol.
Okay.
Now you normally do 2 cleans per day, right?
Yeah.
So just one of the cleans it would be spore, then alcohol, and the other clean would be Decon Quat, then alcohol.
Okay.
Okay. Remember contact time? Do you know the contact time for these? Yes. So whenever you clean this for Decon Spore and Decon Quat, let it set for 3 minutes before you apply sterile alcohol to it. Okay? Alrighty. I'm gonna close this up and then I'll quickly do the little ISO 5 spot. I'm actually not that good at closing this thing.
When do you change the gloves?
Once a month?
No, every 6. You mean the sleeves?
Yeah.
The gloves.
What those?
Oh, these.
Or
These
you
are once a
mean
week, right?
That's, yeah, once a week or if it's torn.
Yeah, once a week or if it's torn, and then the actual yellow gloves are cleaned once
Change
every
every 6 months.
6 months, or if it's torn. Okay?
And question again, so if
Yes.
we take that out,
Like, what is that?
the,
Yeah.
the extension thing,
Yes.
like that, we
So-
can take it and leave it out?
No, I would recommend leaving this inside the hood at all times if it's been taken out like it was today before I started cleaning, it was already outside the hood. To bring it back inside the hood, you have to do the same process of you clean it with sterile alcohol, the entire thing, put it in the empty chamber for a minute, and then it can be brought back in the sterile part of the hood. Does that make sense? And we'll lock this one. And I would, once again, give this, just like on this side, how there's a minute, I would put this timer for a minute to let this air exchange back to ISO 5 before you use it. Okay? Alright. Do you mind tossing this for me? Thank you. Alright. Now I noticed just now this is not closed all the way. So this should always remain closed all the way when it's not in use, because otherwise it won't maintain the ISO 7 clean air in there. Alright, so I'll go ahead and clean this part real quick. I'll explain the process one more time, just from the ISO 7 side. So using the concoir, same thing, cleanest to dirtiest, top to bottom. You want to pass me the deconcoir? Thank you. And same thing on this side, just as Karen mentioned, you can lift this up and get over your pad. Pad. More. Just inside here. And then before use, let it cycle air again. And then really good practice is also, just as you're doing this, clean the high touch surfaces. So doing this handle here. And high touch surfaces are supposed to be cleaned daily. So if you can think of anything else, even like, I know we don't clean these, but you could clean like the actual handles itself here. And then once your hood is cleaned, once again, deconcoir and then sterile alcohol afterwards. Once your hood is cleaned, after this, the next step is the part here. So similarly, can I see the decon clock, please? Following same principles, cleanest to dirtiest, top to bottom.
On that area, you could just spray, right? Instead of spraying on the
Yes,
top?
yes, you can, you can. But just to make it easier for everyone to understand, I always just recommend spraying on the cloth. The reason why we don't just spray is because it's technically a vector for a bacteria to travel on if it's sprayed through the air. So technically, that's why they recommend now to spray on the cloth first. Okay. Clean this high touch surface. Yes.
So since we're opening everything and dating it, so aren't we supposed to date those when it was open also, or no?
Which ones?
The lint-free cloth.
The lint-free cloth. So that
I
is
don't feel that it's sterile. It's like right there. With
it's
all
not supposed to be
everybody's
sterile.
testing it.
It's supposed to be lint-free. So what lint is basically, you know, if you get a tissue and you like mess with it.
Bacteria though.
Yes, but I'm not sure. The answer to your question is I can look into whether or not we're supposed to date these or not. I don't think so because
I mean, just like how this is open to.
Yes.
I mean, it's a big old package too.
but it's not it's lint-free, which is the real goal here.
Not the bacteria.
Well, so the concern is that with lint, so like a tissue, if you
Right.
mess with tissues, you'll see like that powder that comes off of it.
What you wiped it with also isn't like lint-free. The one that came in with the gown.
Oh, I also
That's
don't.
when we just throw it away. We don't reuse it.
Oh, really?
Yeah.
I also don't know about that. I can check whether that one is lint-free as well. That's a good question. Some things that I personally have not thought about. So, like,
We just throw it away. We don't.
okay, okay. I can provide clarification on whether or not we want to just throw that away or not. Okay? I can't give you a hard answer right now. All right? So we'll clean the top of this. We'll clean the bottom. Right? And this gets done every day. And then lastly, and this will be new, but lastly, we're gonna clean the sink every day. The reason why is because the sink is one of the biggest risks for bacteria. Specifically, a bacteria called Pseudomonas comes from the sink. So we're going to be cleaning that every day. That's what's recommended by USP and the Joint Commission once as well. So I don't know what this is.
That's to hold your rooms or.
Okay.
errands, I guess.
Okay, that's fine if we keep it in here. We just have to clean it every day. That's fine. Technically, rings and earrings should never enter the IV room.
Well, we could take that one out.
Okay.
What about the soap thing? Do you always, are we not going to be cleaned also?
Yes.
I mean, it would be best to get something that you could just let this.
I think that's a great suggestion, Carrie, and I'll bring that up. They have ones that you put your hand under and there's a little foot pump.
Right, that's from surgery too. That's really nice. With
Those are
water,
really nice.
too.
Yep. So I'm going to make that suggestion and I'll try and fight for that. I think that's a really good suggestion. Until then, we should be treating this as a high touch surface
Yes.
and also cleaning it as well. Okay? And yeah, so just clean the sink.
I have a question.
Yes.
You said when washing up 30 seconds. Did you say 30 seconds?
Washing up to your elbows.
30 seconds?
You're supposed to scrub for 30 seconds. Yeah.
Okay, so what if we had long sleeve scrubs?
Long sleeves, the undershirt.
Oh, the
Yeah.
stroke.
So you should roll it up above your elbows.
What if we can't roll it up? I'm just asking.
Yeah, no,
I mean, it's fine.
Totally
though, but,
valid
like,
question.
right here.
It's
wear
recommended
this.
to not to wear something that you have up to your elbow accessible.
Okay.
Okay. Technically, USP does say T-shirt, like a short sleeve T-shirt. But I'm not gonna make it like a hard no on the long sleeves as long as you can roll it all the way up, so you can wash properly still. Okay.
Okay. Throw it out there. Just-
On our institution, I wrote our policies for our institution. In our institutional policy, I said short or long sleeve shirt, as long as you can roll it up and you clean up to your elbows. Okay? Do either of you have questions about this process?
When you clean the sleeves on the outside.
On the outside here,
Yeah.
it's a good question. It should probably be a part of our daily cleaning as well. Do you take the sleeves and you do?
We don't clean the, no.
This
we've
right here?
never- No.
Okay. So I'll get back to you on this, but I think it would be good to clean the inside of the sleeves here as well.
With the
And-
decon?
Same process, so decon followed by sterile alcohol. And I'll provide clarification on that to the team as well. Okay? All right.
And the filter is changed every 4 months.
Yes. This is not something that you do, right? Or is this
We do.
something? Oh, you do.
Yeah.
Okay. All right. Maybe that's something that next time it gets done, I can observe you guys and we can make sure that we're doing the right process with it. But do you have any concerns about changing the filter? Okay. All right. You said every 4 months. I'll have to verify that, but it sounds right to me as well. Okay.
And when is the certification for this?
I think it's annually.
Oh,
I don't-
every year?
Annually or every 2 years. I don't know when the last time it was.
It might be up
Start date 4th of September 2024. So I'm pretty sure it's annually. Okay. And this is just our daily cleaning. This is not including monthly cleaning, which is something that EVS will do in our new space whenever we eventually get there.
What do you mean by that?
So monthly cleaning is like floors,
Oh, yeah,
walls,
yeah, okay.
ceilings.
I thought you meant of this,
No.
the isolator. Oh, okay.
EVS shouldn't be cleaning the inside of this.
Okay. And you know how we're not supposed to use tape and stuff, but they use label. You see those right there? Those are, they put the labels up.
Yes. Do not use sticky material here because, as you can see, it leaves residue. That's a big no-no and something that we could potentially get dinged for by Joint Commission. So now that I noticed that, actually, I didn't even notice it, but I'll probably come in here with some cleaner and work on getting that off. All right. Thank you, you three, for all your help. I really appreciate it. All right. Once you're done with your garb, you take it off and you have to wash your hands one more time, and then you can finally come out of the IV room. Thank you, guys.